Hello, everybody. This is our community group presentation presented on vaccines. This is going to be done by Nishal Law, Chaz McCoy, and Alistair Davis, and this is about San Joaquin County. So first of all, what is a vaccine? So vaccine is a type of medication that trains the body to fight diseases, prevents you from getting sick, and you may get sick, but it'll lessen your symptoms. You won't exacerbate any symptoms. And the whole point of having a vaccine is to keep you out of the hospital and hopefully lessen your chances of infecting other people. It's usually given by needle or injection, but there are some vaccines that are also given by mouth too. So as we look at the timeline, we can see that the first successful vaccine was done in 1976. Obviously now it's 2022, so there's been a lot of technological advances in vaccines, their safety, and how they've been, constructed in the lab, and how much time we use them with patients now. And then just going more about how vaccines work. So pretty much the vaccine allows the immune system to create antibodies that help to kind of recognize the virus and make, like I said, antibodies that will help and remember how to destroy them. So for future times when the body does encounter the vaccine, it's able to recognize it quickly. It's able to create what it needs to in order to combat it. And this way your symptoms will not last as long and they will not be as severe in compared to encountering the virus for the first time, and then the immune system doesn't really know how to respond to it. We'll talk about the importance of vaccinations and how it affects the community. So immunization saves lives, reduces chances of spread from one person to another. It's safe and cost effective, builds immunity, and it protects everyone. And one of the most important things is that it's able to prevent spread from people who are not able to get the vaccine. So if someone is immunocompromised and you are the one getting the vaccine, you're lessening your risk of spreading that virus or disease to the other person who is not able to get the virus. So we're going to talk more about how this affects San Joaquin County and how vaccinations are a good tool to protect everyone in the community.
One of the number one leading causes for hepatitis, which is a inflammatory of the liver, which is caused by a virus. Some of the symptoms would include fever, loss of appetite, abdomen pain. Risk factors would include unprotected sex, sharing needles. Preventive measures would be getting vaccinated. In addition to that, you can use condoms, and obviously you don't want to share needles. I know that we're talking about vaccinations, but we want to also touch on some of the diseases that are associated with not getting vaccinated, which would include hepatitis being one of them. There are several different types of hepatitis. There's hepatitis A, B, and C. It develops in 90% of infants. It's a leading cause of liver cancer. Hepatitis C has no vaccination, and sometimes you can actually catch the virus due to medications as well. How is hepatitis transmitted? Well, hepatitis A is transmitted by contaminated foods, sexual contact. Hepatitis B is transmitted by blood-on-blood contact, sexual contact, and all sharing of needles. Childbirth is another way that you can transmit hepatitis B. C pretty much is the same as B as far as transmission, which would include childbirth, healthcare exposure, sharing of needles and sexual contact, and also blood transfusion. Hepatitis D, which is a very uncommon virus, but it is something that can be transmitted through birth, sharing of needles, sexual contact, and blood-on-blood contact as well. resources for hepatitis vaccination. You can talk to your healthcare provider for more details. Visit your local Walgreens or your Rite Aid or CVS or whatever pharmacy that you utilize. Or you can also visit the CDC website in regards to more resources on how to get vaccinated for hepatitis. As a reflection on the assignment, I come to realize the importance of getting vaccinated and how would I use it in the future, which would be to educate my patients on the importance of getting vaccinated as well.
So there's different types of vaccinations. One of the more common is used to produce HPV vaccines. But when you do large scale vaccinations, it can really help at immunizing a population. So they did this study where there was 14 high income countries. They mass vaccinated 60 million people, and then they checked them over time. 8 years after the vaccination, and this meta-analysis study, there was a reduction of genital warts that were produced from HPV. So vaccinating, kids that weren't even sexually active, and I think it was just one side of it was just the females between a certain age group. They vaccinated all these females, and in the entire population, it caused a decrease of genital warts. So that's pretty interesting. And then, HPV is it's probably the most common sexually transmitted disease. It can affect the different mucous membranes, vaginally, the penis, and then also skin. And you can get different types of cancer from HPV. It doesn't just have to be in your genital region. It could be in the throat. It's just it causes a mass mutation of skin cells or mucus cells, epithelial cells, basically. And so the vaccines are designed, for infection, cervical cancer. And as Nishal talked about a little bit earlier, they're designed to boost the immune system to develop antibodies against certain antigens.
So as Ace was talking about, and also Chaz, it's very important to get vaccinated for our protection, and also for the people that are immunized, are not able to get them. So as far as considering our county and the places that we live in, so these are some resources that we have available for people in San Joaquin County. Any pharmacy, CVS, Walgreens, we have a Kaiser Center. We have multiple drive-up vaccination sites that are still giving out COVID-19 vaccinations. And we also have community medical centers. For example, one is on 2015 East Mariposa Road in Stockton. And so we have a lot of different avenues of getting healthcare and getting the vaccinations that you need. And as we look at this map right here, this shows the amount of vaccines given in San Joaquin County of COVID-19. And as we can see from the map, from Stockton to Manteca, Lodi, and the general San Joaquin County area, we have more than 70% of our citizens are fully vaccinated. So that has helped to reduce COVID-19 infections in people, and also keep hospitalization numbers down with COVID, which has helped to, decompress the hospitals, which were already at maximum capacity.
So, you want to talk about like populations that are at risk. certain communities are not able to have access to vaccines, like not too much here in the US, but more in third world countries. But it's important that everybody has access and they have a choice to get vaccinated. They get it, and it really strengthens the herd immunity of a population. And then, yeah, we touched on a little bit earlier. There was it didn't really happen too much during COVID, but people that are at risk in San Joaquin County are homeless, people that just are knowledge deficient about vaccines, and then there's, you know, the choice of not wanting to get a vaccine. So,
And then as Ace was talking about, you know, there's always a choice about getting a vaccine, and how we talked about access for healthcare. So you can also go into any emergency room, whether it's St. Joseph's Medical Center, Dameron Hospital, Lodi Memorial Hospital. They're all obligated to help, you know, anyone that needs, you know, medical assistance or is having a medical emergency without the, depending regardless of the ability to pay or insurance. So that is a resource that we want everyone in San Joaquin County to know, and know that is always available for them 24/7. And this is our Works Cited page. We just hope that, you know, through this presentation that we're able to help our patients in the future about vaccines and how to prevent them from getting, you know, very sick and exacerbating their symptoms, whether it be COVID or hepatitis or HPV or anything that's preventative. We want to be there for our patients and help spread any kind of education that we can. So that has been our presentation, and I hope that things go well with everyone. Thank you.